Simon. I hope you're well. Hope everything is good. Just to summarize the few lectures we talked about, we can just do it here again. For climate change, it's before you finish the topic, just step back and organize your ideas into a conception or concepts, and basically just know that it's not about memorizing facts, but you want to understand the patterns as well. So let's start with air pollution and temperature. As the climate warms, we get hotter days, we get chemical changes in the air. A higher temperature increases the formation of ground level ozone, which is a powerful respiratory irritant. This is why respiratory symptoms often worsen on hot afternoons rather than cold mornings, and this is especially relevant for patients with asthma, COPD, or any cardiovascular disease. So think of temperature more of like an amplifier of existing air pollutants, not something that's separate from them. Um, Very important is remember the PM I showed on the graphs and the slides. It's called particulate matter. So this is very especially very fine particles that can reach deep into the lungs. So these particles don't will irritate the airways, and they can also worsen heart disease, trigger inflammation, and increase hospital admissions. Now about wildfires as well, it's important again. Climate change increases the drought and dries vegetation, which makes wildfires more frequent and more intense. And what matters clinically is not just the fire, but also the smoke, right? We talked about the smoke, that the wildfire smoke contains fine particles and toxic gases that significantly reduce the air quality. And even people without previous lung disease can develop respiratory symptoms, and those with chronic conditions are at a much higher risk. Also, allergens behave differently in a warming climate. We talked about that. Remember, there was a sunflower slide. So higher carbon dioxide levels and longer warm seasons mean plants produce more pollen for longer periods of time, and this leads to longer allergy seasons, a higher pollen counts, and more asthma exacerbations. So when you hear a patient says their allergies start earlier and last longer every year, think of the climate, not just like sensitivity at a personal level. Also, about extreme heat being one of the most dangerous health effects of climate change. So, heat waves also place enormous stress on the body. They cause fluid loss, dehydration, electrolyte imbalance, and reduce blood flow to vital organs. Older adults, people with kidney disease, cardiovascular disease, or limited access to cooling are particularly vulnerable. Heat causes discomfort for sure, but also leads to hospital admissions and excess deaths, which we've already seen on a larger scale in Europe. Remember, we talked about that as well. Also, climate change can also changes where the disease occurs. So we talked about temperature playing a key role in infectious diseases, especially those transmitted by insects. As remember, we talked about like regions warming up and frost-free seasons lengthening. So mosquitoes and other vectors expand into new areas, and diseases that were once limited to certain regions, they can appear in places that were previously considered low risk. Again, this is not due to better testing or travel, but because of the ecological shift that's happening. At the same time, also food and waterborne diseases become more common in hotter climates, and heat allows pathogens to survive longer in water and food, and drought forces communities to rely on unsafe water sources. And again, children are especially affected. Also, mental health is not separate from climate change. It's affected by, we talked about that as well, like environmental disasters such as wildfires, floods, and extreme heats are also linked to anxiety, depression, and PTSD. And again, beyond disasters, having sustained higher temperatures themselves are associated with worsening mental health outcomes, including increased suicide rates, especially among people with pre existing mental illness. Also, we talked about being it critical to understand that climate change is unequal and unfortunately not equitable. So again, although high-income countries contribute to most to greenhouse gas emissions, the health burden falls disproportionately on low-income and disadvantaged populations. Having limited access to cooling, healthcare, clean water, and emergency services means these communities will experience more severe outcomes. And climate change threatens progress in global health development and universal health coverage as well. And again, we talked about our role as future physicians. Two broad responses to climate change. Number one was mitigation, which focuses on reducing greenhouse gas emissions, and adaptation, which focuses on reducing the health impact of climate change that is already happening. So, as physicians, your most important role is in adaptation, and this includes recognizing climate related illness, protecting vulnerable populations, preparing health systems for heat waves and disasters, and responding effectively when these events occur. And conceptually, adaptation is very similar to secondary and tertiary prevention in medicine. So, if you understand these patterns, how temperature affects air quality, how heat stresses the body, and how disease ecology shifts, and how mental health is impacted, and why equity matters, you don't need to memorize anything, right? You just need to think like a physician. So, it's pretty straightforward for climate change. And again, for AI as well, let's go through it very quickly. So again, some core themes we talked about. Remember AI making a big wave in diagnostics. So imagine you're like in a busy emergency department. Patient comes in with respiratory symptoms and a chest X-ray is done. Now picture an AI system that's trained on millions of similar cases stepping in, and doesn't replace the radiologist but supports them. And it highlights findings with a level of speed and consistency that humans can't match. So that's important. And then the point is not that AI is better than people, but that it's enhancing human decision making, especially in time sensitive cases and things like that. Also, what you want to know about is in pathology, like there are certain AI symptoms that we remember we talked about a lot of AI systems in pathology. So there are certain ones that can now assist in analyzing biopsy slides, helping pathologists detect microscopic changes that may indicate early cancer. And again, you don't want to replace your pathologist, but you want to draw their attention to areas of concern that might otherwise miss, or especially under time pressure as well. And also you want to think about personalized medicine. We have now systems that don't just react, they adapt as well. So take diabetes management as an example. So AI enabled insulin pumps can now integrate glucose data, physical activity, and even dietary inputs to make real time adjustments. So again, it's automation for the sake of convenience, but it's also machine-driven personalization that responds to an individual's dynamics, needs, and things like that. Mm, what else? Yeah, we also talked about AI playing a major role before disease even appears. So in many health systems, we talked about EMRs or electronic health records now analyzed using predictive algorithms to flag some patients who are at risk of conditions like dementia long before human clinicians, might notice those subtle warning signs and things like that. And again, proactive care that's enabled by AI is increasingly shaping how we approach early diagnosis. And then there's the operating room again. Remember, we talked about that, where AI is not really performing the surgery but assisting during it. So um, it can track instrument movements, suggest adjustments, warn about errors before they happen. I gave you guys examples about those, and it's like a second set of eyes, but those eyes don't really blink because it's a camera and it's AI and things like that. So again, it's highly valuable and complex and high stake procedures. And again, AI is not just like about, having highly technologically advanced hospitals or things like that. If you have a rural or low resource setting, the AI tools are enabling diagnosis where lab equipment or trained professionals are scarce. And again, something as simple as a smartphone with an AI app can now help identify a disease like malaria from a blood smear image, or things like that. So again, that's your AI for global health equity. So you want to talk about how like the AI is not just for the elite but for everyone, right? We also see AI outside the clinical walls. So wearable devices like smartwatches now come with medical grade sensors, and they're not like fancy fitness or Fitbits or whatever, but they're capable of detecting serious conditions like atrial fibrillation and alerting both patients and physicians in real time. And again, the key takeaway here is that AI will enable continuous care rather than episodic care. Remember, we talked about that. So again, yeah, I'm getting a little tired, but I don't have time to give a session, so I hope all the first years get to hear the review. And yeah, very important again with AI is ethics. So again, one of the biggest concerns is of bias, and if an AI model is trained mostly on data from one population group, it may perform poorly or even dangerously on others. And again, this is a real concern when it comes to triage, diagnosis, or treatment recommendations. The decisions made by AI are only as fair and accurate as the data it's trained on. And then there's accountability. So if a machine makes a decision that harms a patient, who is responsible? Is it the developer, the hospital, the clinician who relied on it? Again, these are like the type of real world legal and ethical challenges we are grappling with as AI becomes more embedded in healthcare systems. So, of course, there's also privacy. So, AI symptoms gain access to huge data sets, often including sensitive information about patients and things like that. So, you have to ensure it's protected, encrypted, and ethically managed. And again, remember what powers AI or these systems is machine learning and deep learning. And machine learning allows the AI to learn from past data. Remember that picture I showed you in the beginning, improving from that past data and then improves over time without needing to be explicitly programmed. And then deep learning takes it further using complex neural networks to process high dimensional data like medical images, and it also helps you identify patterns that humans may miss. So again, most of what we use in medicine is still narrow AI, which is task-specific systems or that are built for like one single purpose, such as reading chest X-rays or flagging lab abnormalities. We're again far from reaching general AI, but which could be capable of reasoning across specialties the way you or I or any other physician can. So again, you want to think about how AI supports but doesn't replace the physician. Where does it show up in the patient journey from prevention or treatment? What are the opportunities and risks, and how should we respond to them because of ethical concerns and things like that? And how do they show up in clinical tools that you may use one day, and things like that as well. And then access to care again was a very short lecture, so I will give it summarize it a little bit and talk. So when we talk about universal health coverage, we're not talking about free health care for everything. We're not talking about equal income or unlimited spending. The core idea is much more practical. People should be able to get the health services they need across prevention, treatment, follow up without being pushed into financial distress. If someone avoids care because they fear the cost, even when services technically exist and the system is failing its purpose, right? And this concept is very central that it sets at the heart of global health priorities. Among the international developmental goals, health is treated as its own pillar, with universal coverage explicitly built into it. So that tells you that access to care is not a side issue, it's a foundation for population health. Now, access also never really one dimensional, right? So a clinic can exist, services can be free, and yet patients may still not benefit. And that's why we always analyze the access through multiple dimensions. So one major dimension is information. So a patient doesn't know what a service is or if it exists, does not understand it, when to use it, or believes it's only available elsewhere, then access is effectively blocked even if the case is right in front of them. Health literacy matters as much as infrastructure. Another dimension is about financial access. This is not only about hospital bills, but it's even when care is officially free, patients may still feel like there are some transportation costs, missed work days, meals, or accommodation expenses. And again, when these indirect costs accumulate and threaten household stability, we call this a catastrophic health expenditure, and that directly contradicts the purpose of universal coverage. And then we talked about, remember, there was a picture of a car in the desert. It was basically about physical access. So geography does matter. Distance also matters. Transportation matters. Services that exist on paper but require hours of travel. Unavailable public transport, let's say, or unaffordable logistics are not truly accessible. So, again, this is a recurring challenge in rural settings globally and also with us in Saudi. So, another commonly overlooked dimension is quality, and access to poor quality care is not real access. So, services that are unsafe, ineffective, or poorly regulated or delivered by inadequately trained staff can cause harm rather than benefit. And again, quality is inseparable from access, a system that cannot claim success if patients reach care but receive substandard treatment, right? So again, these dimensions often overlap, and a patient may face physical distance at first, and then financial strain, and then information gaps, and then all at once. So again, real patients rarely experience these barriers in isolation. So when we look at these internationally, we see how different systems struggle with different gaps. So, in some settings, services are free but too far away. In others, insurance exists but providers refuse to offer care due to a policy or reimbursement issues or things like that. And then this highlights an important distinction, right? Having coverage does not always mean services are actually available. So this is also important. Again, some countries demonstrate that universal coverage can work when there is a strong regulation, cost control, and long-term planning, even with aging populations. Success does not come from privatization alone, but from deliberate system design and oversight as well. On a global scale, also, we have seen that there's coordinated public health strategies that change outcomes. So diseases that once affected millions have been controlled through early diagnosis, free treatment, community engagement, international cooperation. And similarly, major reductions in infectious disease burden have come not from just hospitals alone, but from combining prevention tools with effective treatment strategies. So, again, finally, when we do talk about improving access going forward, three ideas do come up, which is coordination, innovation, and shared commitment. So, coordination systems must be able to communicate, refer properly, and function as one continuum. The innovation part would be like digital and community based solutions that simplify follow up and continuity. And the third shared commitment would be about healthcare workers, policy makers, and communities working together rather than in silos. And if you understand these principles, what access truly means, why having financial protection is there, and why it matters, and how physical distance and quality can affect care. And why coordination and innovation is essential, then you're thinking like a public health physician, and that will help you with your exam as well. All right, good luck and take care. Thank you.